Why are we all here today? Why should this be important to us? We all came from a mother. We all came from a mother. And some of us were blessed to have our mothers with us for our entire childhood. And some of us were not.
Every mother and every child is deserving of an opportunity to thrive. Every single one. And what we have to share by way of thoughtful, dignified, and quality-based care is exempt from no one. Now, I have some news to share, and I hope it makes a headline somewhere. So tell a friend and tell a neighbor, tell a naysayer even. Not only did Caring experience its best birth outcomes since its implementation of its maternal child health program since 2008 last year. We can clap. Even better, the preterm birth rate for Mecklenburg County, as of this year's March of Dimes report, is at its lowest since 2016. Not only did our preterm rates go down, but hold on, also did our low birth weight rates, also at its lowest since 2015. I'm looking out at you from the stage, and I'm seeing the communal solidarity amongst one another that we have, and a shared determination to progress even further. We're going to take it from a C to a B, and a B to an A. We are going to continue trudging this path so that every mom and every baby unequivocally have the access to dignified maternity care. Every mom and every baby will unequivocally have access to respectful maternity care, and every mom and every baby are going to unequivocally have access to the right to life, but not just any life. A life where they can grow and they can thrive regardless of race or ethnicity or zip code or any other difference in their demographic.
So when we look at our maternal deaths, and oftentimes we're focused in on the maternal deaths, and below that iceberg, which we sometimes forget about the maternal morbidities and the severe maternal morbidities that are not talked about a lot. So when we look at our maternal morbidities, there may be things like a cesarean birth, an episiotomy, things of that nature that happens sometimes during a routine labor and delivery. But our severe maternal morbidities are those near misses. And those are the things places where we can take action and hopefully resolve and reduce some of the practices that's causing or contributing to these severe maternal morbidities.
No one entity in Mecklenburg County can help us tackle any healthcare issue, and we have to do it together. And it is because of the partnerships with Genevia, with the state, and others in this room that we're able to make some progress. We do have ways to go, but we are making progress. Moms are healthier, babies are healthier, and we all deserve to just take a minute to pause to appreciate that. And so I just want to make sure you guys know I appreciate you for all that you're doing to make us get to that place. As we're thinking about not just building programs, not just new initiatives, not just new individual activities, but how do we create systems? How do we transform systems? How do we break systems that don't work? How do we fix systems and rebuild them in a way that allows for no woman, no child, no family to be left behind or slip through the crack?
But I really have to center the lived experiences of the families that are impacted by this maternal health crisis. Because what I want you to understand is that these families and these mothers that we are losing are so much more than just statistics. They are so much more than just numbers on a graph. And we talk about the dad, and some of you have heard me talk before. You've heard me talk about my wife and Kira and how she was sunshine personified. But I want you to hear me say is that there's no data point that can quantify what it's like to tell an 18-month-old that his mommy's never coming home. 84% of the mothers we are losing are classified as preventable. Right? Think about that. 4 out of every 5 mothers that we are losing should be here. They should be here at the first day of kindergarten. They should be screaming at soccer games on Saturday mornings. They should be dancing at weddings, and they deserve to grow old to be grandmamas.
Momnibus is a collection of 13 bills, and all those bills really help to deal with the problems that we know exist. Whether those are problems where we know that doctors are not always, medical folks are not always sensitive. They don't always listen, and especially and a lot of the times they don't listen to black women. And that's part of the problem. But of course, there's a cultural issue as well. And so one of the things that we wanted to do was to help the medical folks understand a little bit more about themselves and how you not only have some compassion for people, but that you don't judge people. We wanted to expand and diversify the perinatal workforce. We wanted to data collection. It's really important that we improve that so that we'll kind of know what's going on, know what we need to do and so forth, but also to support community-based organizations. It's the folks who are on the ground. You are the ones who are doing the work. And it's because of the work that you're doing, we're able to collaborate and partner with you, and that's what Representative Underwood and I have done. As we've reached out to organizations like Black Mamas Matter and many of those that actually helped us to launch Momnibus. Everything
that Congresswoman Adams said, I'll just add a couple of things about the Momnibus, and this is just, one of the things that I'm proudest of about this piece of legislation, first of all, the boldness and the audacity, right? To not come with 1, not 2, not 3, but 13 different bills, saying that we want to make sure, guess what? We deserve all of it, right? And our mothers are dying, and we are going to come, as she said, with a comprehensive package. That's 1. 2 is that this was a community-informed piece of legislation. This wasn't something where Congresswoman Adams and Congresswoman Underwood had their staffers do some research, had put something together, and then called folks together for a press conference. They brought the people who are doing the work to the table. They brought Black Mamas Matter. They brought families like mine that have been impacted. They brought the March of Dimes. They brought all these organizations to the table and allowed us to give input. And I'm gonna be honest, do you know how hard it is to get all these organizations to agree on 13 different bills? But that is a testament to the way that they lead. When we talk about this issue of maternal mortality, and particularly Black maternal mortality, the way we've been able to make progress on these issues is to position this as what it truly is. It's not a women's health issue, it's not a Black issue, it's not a rich issue, it's not a poor issue. It is a human rights issue.
Yes.
That deserves all of our attention.
Yes. So I know I'm standing in between you and what I hope are some really deep and meaningful reflections for the next 365 days until next year. Heart health, daddy doulas, empowering through peer education, body image, bridging the gap, HIV, strategic frameworks, all of it necessary. We had that conversation today. And our hope is that you take everything that you gathered whether it be knowledge or relationships, and that you're going to use it with intention and purpose in the work that you're doing. Or in some cases, you may apply it to those you love or yourself. So may you continue to do the work that you are doing, not despite of, but because of, and remain true to everything that you're telling us you're committed to, not just in words, but in action.